My name is Kasey. I am 35 years old. I am a mom of 3 and I'm a professional organizer. I have a 6-year-old, a 4-year-old, and a 2-year-old, so it's a little crazy at my house right now, but it's fun and I love them, even though they're hard. When I first wanted to get breast augmentation was when I was around 21. This is when big boobs were a huge thing. I was always little and petite, so I just wanted to, feel a little bit more full. So I got them done then, and then after being pregnant and breastfeeding for 6 straight years, I decided to get them redone because they were just needed a little tune-up. When I was considering a revision, I knew it was time because me and my husband were done having kids. We decided on that first, and I knew I wanted to go back to the same surgeon because I loved what he did the first time, and that's when I decided to get revision. I found my plastic surgeon because at the time all my friends were getting breast augmentations, and so they recommended him. I went with him, and that's that. One thing I love about my surgeon is you can talk to him and he explains things in full. So if I'm having questions or I want to change something, he's very educational, and so that's one of the qualities I love. The revision appointment was a little bit different than the first. There had been some, fat loss after breastfeeding, so my tissue wasn't as, full to begin with. So, and I wanted to still not go as big, I guess. And so it was a little different. It was more of revamping than changing my look. When discussing with my plastic surgeon what kind of look I wanted, it was less about the CCs. I showed him pictures of models that I love, celebrities that I loved how they looked in clothes and in bikinis. The first appointment was all about the CCs and how big, and the second was, okay, how do I want it to look on me? How does my body, my full body want to look? So that was completely different. When I met with my surgeon, he used a visualizer and he put me on screen and we tested out a few different options so I could actually see what I would look like after the surgery, and it was spot on, so I was happy with that. When I met with my surgeon, we both kind of came to an agreement what breast implant was right for me. I felt them all. He described all the different kinds, and I trusted him because of the first time, so we decided to go with Natrelle, and it was perfect. My surgeon advised me after surgery that I couldn't lift my kids, so I brought in my mom from out of town. She helped with that, and no putting your arms over your head. I would encourage people to get some help for a few days after. When my mom friends ask me for advice, I always tell them to do what you feel is good for you. Don't listen to your husband. Don't do what your husband wants. Don't do what your mom wants. Go with the size that you want to do, and it's for you. I am so happy with my look. I'm so happy with the results, and my surgeon did exactly what the pictures, I showed him the pictures, he did exactly what I wanted, and I'm so happy. My favorite thing about the results is I never have to wear a bra again. I feel nice and full in all my favorite outfits. I literally have not bought a bra in years, and I love it. Once I was fully recovered, I could not wait to go to the beach and get in a bikini and take pictures and family pictures. I just felt really good. After my breast augmentation, my 3 favorite pieces of clothing I wear are lingerie for my husband. I feel very good about that. And then swimsuits, I'm always at the beach or at the pool. And then just even like dresses going out, I feel so good about my look now. The power of you is so important for me, especially being a mom of 3. You take care of your kids, but the most important thing to take care of is yourself. Doing stuff like this for yourself is so empowering for me, and I want my kids to see that, and hopefully I portray that for them.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.